Hello. A very good afternoon to all of you. So today the topic of my presentation now will be on genetics and learning disability. So before going to the topic, we have to know what is learning. The definition for learning. Learning is defined as acquiring new or modifying existing knowledge, behaviors, skills, values or preferences, and it may involve synthesizing different types of information. That is the definition for learning. According to Illyris, learning is a process that brings together cognitive, emotional, environmental influences and experiences for acquiring, enhancing or making changes in one's knowledge, skills, values and worldviews. That is the definition by Illyris. For those who are not familiar with the word cognitive is pertaining to the mental process of knowing, perceiving and remembering. According to Henry Ford, anyone who's, I would like to get this quote from Henry Ford, that is, anyone who stops learning is old, whether at 20 or 80 years. Anyone who keeps learning stays young. The greatest thing in life is to keep your mind young, so keep on learning. That's important. So what about people who are not able to learn properly? There are a lot of children who are not able to learn properly due to some disabilities. Of course, we know that education is the fundamental right of every child, but if you take a survey of the school-going children, we can see that nearly 1 to 30% of the school-going children are estimated to have problems in learning. And they face invisible difficulties in learning and find it difficult to cope up with the academic demands of schools. So what will be the result? Usually they will be dropping out from the schools. That's a very sad thing, mainly because of some disabilities in the learning process. So what is this learning disability? Learning disability refers to a varied group of disorders that is manifested as a significant group of difficulties in the acquisition and use of listening, speaking, reading, spelling, writing, reasoning or mathematical abilities. Any of these any disability in any of these aspects can be considered as a learning problem. It is actually a neurobiological disorder that affects people's ability to either interpret what they see and hear or to link information from different parts of the brain. So problems that affect the brain's ability, learning disabilities are problems that affect the brain's ability to receive, process, store, respond to and communicate information. There are a group of varied disorders that have a negative impact on learning, and it will affect the one of individual's ability to speak, listen, think, read, write, spell or compute. It is actually a diagnosis and not a physical or a mental illness. Now coming to the different types of learning disability, the number one is known as dysphasia, meaning speech language disorder. So such children with the dysphagia will face difficulty in producing speech sounds, then difficulty in perceiving or understanding what other people say, or they may find difficulty in putting ideas into spoken form. The second one is known as dyslexia, that is disability in reading. Such children may find it difficult in phonetic mapping, or difficulty with spatial orientation, or difficulty with the sequential ordering. The third type of learning disability is dysgraphia, meaning a disability in the area of written expression or in the physical writing. So they have impairment in handwriting or impairment in spelling or impairment in the organization of ideas or impairment in the organization of composition. And the fourth one is dyscalculia, meaning a disability in the area of mathematics. So such children face difficulty in learning math concepts or memorizing math facts or organizing numbers or in understanding how math problems are organized on the page or page. And so such this difficulty is often referred to as having a poor number sense because of all problem related to mathematics. So how to identify children with the learning disabilities? Children with learning disability usually have severe discrepancy between intellectual ability and academic achievement that what is expected at a particular age. So a child with a difficulty, if you find a child who has a difficulty in the achievement and potential in one or more areas such as speaking, reading, writing, figuring out a math problem, or communicating with a parent, or paying attention in class, despite this standard education efforts, then that means that the child has some learning disability. And moreover, such children with learning disability also have social or adaptive dysfunction. That means they have poor life skills. They may not be able to some of the basic things which other children are able to do themselves. And usually learning disability occurs in early childhood itself. But we have to understand that learning disability does not include learning problems primarily due to vision, hearing, or motor disability. But of course, children with this problem like vision problem or hearing or motor disability, they also have learning disability, but they are not classified under this learning disability children because their problem is different. So what are the causes of learning disability? There are actually few critical areas where a learning disability could become present, that is events before birth. For example, chromosomal conditions. We know that all the normal individuals have 46 chromosomes. If there are abnormalities in the chromosome, sometimes that can result in learning disability. Abnormality either a numerical or a structural chromosome, that can lead to learning disability. Then maternal factors. Infections caught by a pregnant mother may be passed on to the unborn child, and that can lead to learning disability. Sometimes diet deficiencies in the pregnant mother, that also can lead to learning disability. Then maternal substance abuse. For example, the mother who is taking a lot of alcohol or some other drugs or something like that, that also can result in producing children with a learning disability. Then again, events before birth. In the morning, Dr. Ravani had already mentioned about the metabolic disorders. So that also is one of the cause for learning disability. If, for example, the metabolic disorder phenylketonuria, in which it shows a lack of enzyme which breaks down certain amino acids, then it can be actually detected shortly after birth and controlled through diet. But if it is not detected, that may lead to learning disability. Then another cause is events during birth. Learning disability may result if the baby's oxygen supply is interrupted for a significant length of time, or if the baby is born significantly premature and becomes ill short after that. So that may lead to some brain damage, and that will result in learning disability also. Then events after birth. For example, some of the childhood infections like encephalitis or meningitis, that also can lead to a child developing learning disability. Then there are a few other social and environmental factors. Then coming to exposure to some of the neurotoxic chemicals like lead, manganese, methyl mercury poisoning, thalidomide, chlorpyrifos, valproic acid, pesticides like DDT, tetrachloroethylene. All this exposure to all these neurotoxic chemicals also can lead to a child having learning disability later. So what about genetics? Does genetics play a role in learning disability? Yes, genetic factors do play a role in 40 to 50% of learning disability cases. And most disorders associated with learning disability have at least a genetic component influencing their expression. But we have to understand that learning disability is a very complex area to study, since there is great variety in the number and the types of disabilities. So it's not an easy thing to study the genetics of learning disability. Earlier, genetics studies have been started in studying the families in which learning disability happens. So it has been shown that while learning disability tend to run in families, their expression differs in the parent and in the child. For example, the parent's learning disability may a slightly different form in the child. A parent who has a writing disorder may have a child with an expressive language disorder. So that doesn't mean that the same learning disability a parent has will be transmitted to the child. So the child will be having another type of learning disability. So that shows specific disorders are not inherited directly. More likely, what is inherited is a subtle brain dysfunction that can lead to learning disability. Again, monozygotic twin studies have been carried out. In studies of identical monozygotic twins raised separately, the concordance rate for reading disorders was 68%. The term concordance means presence of the same trait in both members of the pair of monozygotic twins. So the concordance rate was found to be only 68 to 70%. Even though this points to a high correlation between genetics and learning disability, this shows that it is not 100%. So there may be other factors also. There may be other factors which are influencing the development of learning disability. Now, based on the genetic causes, learning disability can be classified into syndrome-associated learning disability and non-syndrome associated learning disability. Syndrome-associated learning disability in children with syndrome-associated learning disability, the intellectual deficits are associated with other medical and behavioral signs and symptoms as part of several syndromes, whereas in non-syndrome associated learning disability, the intellectual deficits appear without other abnormalities. That is the difference between syndrome-associated and non-syndrome associated learning disability. So regarding syndrome, Dr. Falil had already mentioned in detail, so I am not going to the definition of syndrome. Only thing we know that more than 500 syndromes are already there, for which a cause has already been identified. So these chromosomal and other genetic abnormalities account for learning disability in a significant proportion of syndrome-associated learning disability cases. And these are some of the examples of the chromosome syndromes which are associated with the learning disability. For example, the Down syndrome, trisomy of chromosome number 21. Another major syndrome is Fragile X syndrome, in which the individuals will show a fragile area and along the length of the long arm of chromosome X at a site Q27.3 that we call as a Fragile X syndrome. So learning disability is always associated with the Fragile X syndrome. Then there are other microdeletion syndromes like monosomy 1p, Wolff-Hirschhorn syndrome, Cry-Duchat syndrome, all this. In all these microdeletion syndromes also, learning disability is associated. These are some of the pictures of the Down syndrome, European Down syndrome children. There are also European Down syndrome children. And this is the karyotype showing this trisomy of the Down syndrome, trisomy of chromosome number 21. Then Fragile X syndrome, it is the most common form of mental retardation affecting 1 out of 1,500 males and 1 out of 3,500 female carriers. And these Fragile X males have a lot of phenotypic features like macroorchidism, large face, long face, large ears, and most importantly, Fragile X males also have learning disability. It's a major factor. But in the case of Fragile X females, the features may not be that much prominent because they have already 2X and 1X will be, even though 1X will be having this fragile side, it will be compensated by others, the other X, but still few features will be there. How the fragile site happens is shown here. It is characterized by a decrease in the size of an unstable portion of the specific DNA fragment on the long arm of X chromosome, resulting in a fragile area at the XQ27.3 region in the long arm of X chromosome. So this region shows more than 200 CGG repeats, that known as trinucleotide repeats. It happens as a result of the mutation of the FMR1 gene. So normal people will have less than 40 CG repeats, whereas these Fragile X males will be having more than 200 repeats. This is the Fragile X syndrome man showing the long face, large ears, and this is the fragile site on the X chromosome at the region 27.3. This can be identified by cytogenetic methods. We can identify this fragile site by doing chromosome analysis. These are other pictures of Fragile X boys of different ethnic races. You can see that all the boys, they have the long face, large ears, all the like that. Another karyotype showing fragile site on the X chromosome. Here, this is the fragile site. This is another interesting syndrome known as Cry-Dusat syndrome, where the individuals show a deletion on the short arm of chromosome number 5. You can see that this is normal chromosome number 5, but here you can see that this much segment is deleted. So this those individuals with this deletion, we call it, they have some characteristic features, especially when they are born, they cry just like the mewing of a cat. That's why it is known as Cry-Dusat syndrome. So individuals with the Cry-Dusat syndrome also have learning disability. This is the picture of a boy with Cry-Dusat syndrome. Then there are other selected genetic abnormalities associated with learning disability. For example, uniparental disomy. Uniparental disomy means the condition in which a person receives 2 copies of the same chromosome, chromosome from the same parent. Usually we receive 2 copies of the chromosome from mother and father, but sometimes it so happens because of some meiotic error, one individual receives 2 copies from the same parent. That is called uniparental disomy. So if it is uniparental disomy, that also can result in several syndromes like Prader-Willi syndrome, Angelman syndrome, like that. So those individuals with the uniparental disomy also, learning disability will be there. Then these are other genetic disorders associated with the learning disability like tuberous sclerosis, neurofibromatosis. All these diseases are associated with the learning disability. Then coming to the genetic causes in non-syndromic learning disability. Now, so far we have been seeing syndromic associated learning disability. Now we let us see the non-syndromic learning disability. A number of previously undiagnosed conditions in learning disability could be attributed to subchromosomal rearrangements and gene alterations. Estimates suggest that nearly 2,500 genes might be linked with the learning disability. A large number of genes might be linked with the learning disability. A lot of studies are being carried out to identify specific genes or a specific gene associated with a specific type of learning disability, but still so far no specific genes have been identified with the various types of learning disability. Genome-wide association studies have identified 9 candidate loci for the learning disability susceptibility, and these are the 9 loci identified on the specific chromosomes. And then these are some of the candidate genes proposed through other molecular studies. For example, these are the genes that has been found to be as a candidate genes, proposed to be candidate genes for language processing. Then these are the genes proposed to be as candidate genes for dyslexia, and these are the genes proposed for language impairment. And then some other genes with various roles involved in brain development and brain structure and brain functions have also been identified. So, genetic diagnosis of learning disability is of major importance for the care and counseling of patients with the learning disability and their families. Genetic diagnosis can differentiate children with syndromic and non-syndromic learning disability. So, a proper diagnosis provides insight into associated health and behavior problems, prognosis and recurrent risk. And nowadays a lot of molecular studies using high throughput technologies like next generation sequencing, exome sequencing, and copy number variation analysis are all being carried out, and it is hoped that such analysis will yield more information on the genetics of learning disability. It is still a developing field. Not much information are available regarding the non-syndromic learning disability. A lot of research are being carried out. That's all. Thank you.